Have you ever experienced something that completely changed the way you saw your profession? For me, it happened the day I heard three words no one ever wants to hear. You have breast cancer. As a doctor of acupuncture, I had spent more than 20 years helping patients improve their health naturally. But in that moment, I wasn't the practitioner anymore. I was the patient. What happened over the next several months changed my life, changed my practice, and ultimately changed my mission. Today, I'd like to share that journey with you. Welcome to Kikutan Wellness. I'm Dr. Guadalupe Vanderhorst Rodriguez, Doctor of Acupuncture, licensed acupuncturist, Reiki master teacher, author, and wellness educator. On this channel, I share evidence-informed wellness education that combines traditional Chinese medicine, acupuncture, Reiki, and holistic wellness with modern healthcare. Today's story is deeply personal. It isn't about choosing one form of medicine over another. It's about what I learned after becoming a breast cancer patient myself, the diagnosis. When I first received my diagnosis, I experienced the same emotions that many people do. Fear, uncertainty, questions. I suddenly found myself sitting in waiting rooms instead of treatment rooms, listening instead of explaining, trusting others with my own healthcare. As an acupuncturist, I naturally began asking questions. What was the best course of treatment? How could I support my body? Where did acupuncture fit into cancer care? What role, if any, could complementary therapies safely play? I assumed there would be extensive practical information available. To my surprise, there wasn't. At least not the kind of evidence-based information I was looking for. That discovery became the beginning of a completely different journey. I became a student. Again, I decided that if I couldn't find the answers, I would study them myself. For months, I immersed myself in research. I reviewed scientific publications. I studied integrative oncology. I read clinical guidelines. I wanted facts, not opinions, not marketing, not wishful thinking. I wanted evidence. One of the most valuable resources I discovered was Memorial Sloan Kettering Cancer Center's evidence-based integrative medicine program. I spent time learning how their experts evaluate herbs and dietary supplements, not just for their potential benefits, but also for their safety and possible interactions with cancer treatments. That experience reminded me that every decision about complementary therapies should be based on evidence and discussed with your oncology team. One of the biggest lessons I learned was that natural does not automatically mean safe. Some herbs can interfere with chemotherapy. Some can interact with hormone therapy. Others may increase bleeding risk before surgery. That completely changed the way I looked at herbal medicine. Instead of asking, what herb should someone take? I began asking, what does the evidence say? Is it safe? Does it fit with this person's treatment plan? That change in thinking transformed me as a healthcare professional. Discovering integrative oncology. As my research continued, I discovered the growing field of integrative oncology. I learned that integrative oncology isn't about replacing conventional cancer treatment. It's about understanding how evidence-informed complementary therapies may help support quality of life while patients receive standard medical care. I also learned about treatment options I had never heard of before. One of them was GammaPod therapy, a highly specialized form of stereotactic radiation designed specifically for certain patients with early-stage breast cancer. I remember thinking, why haven't more people heard about this? The experience reminded me how rapidly cancer care continues to evolve, and it reinforced something I now believe strongly. Patients deserve access to trustworthy, evidence-based information. My personal decision, as I continued researching my diagnosis, I spent countless hours reading scientific studies, reviewing evidence, learning about integrative oncology, and exploring resources from respected cancer centers. The more I learned, the more I felt I needed to make the decision that was right for me. After much thought, I decided not to undergo radiation therapy. That decision was based on my own research, my personal values, and what I believed was best for my body. Ultimately, I trusted my own judgment. I'm sharing this because it is part of my personal story, not because I believe everyone should make the same decision. Every person's diagnosis, pathology, medical history, and circumstances are different. What was right for me may not be right for someone else. During the weeks leading up to surgery, I focused on supporting my overall well-being. I nourished my body, practiced Reiki, received acupuncture as appropriate, reduced stress, spent time in prayer and reflection, and incorporated holistic practices that helped me feel physically and emotionally prepared. Then came the day of surgery. After the procedure, my surgeon shared something I never expected to hear. He could not find the breast cancer. I was overwhelmed with gratitude. Even today, I cannot fully explain why that happened, and I don't know exactly why the cancer could no longer be found. I cannot say which factor, or combination of factors, contributed to that outcome. What I do know is that the experience transformed my life. It deepened my curiosity, it strengthened my commitment to lifelong learning, and it inspired me to continue studying the role of evidence-informed integrative care so I could better educate and support others. How it changed my practice. Before my diagnosis, I viewed acupuncture primarily through the philosophy of traditional Chinese medicine. After my diagnosis, I began viewing it through another lens as well, evidence-based integrative healthcare. Today, I ask different questions. What does the research show? How can acupuncture safely support patients? Where does it fit within comprehensive medical care? How can healthcare professionals work together for the benefit of the patient? Research suggests acupuncture may help some patients manage treatment-related symptoms such as nausea, pain, fatigue, anxiety, and sleep disturbances. It is not a treatment for cancer itself, but it may play a supportive role for some patients as part of comprehensive care when coordinated with their oncology team. That distinction is important because patients deserve both hope and honesty. My mission today. My breast cancer diagnosis didn't simply change my life, it changed my mission. Today, through Kaikatan Wellness, I want to help people understand traditional Chinese medicine through the lens of scientific evidence, compassion, and collaboration. I want to help patients ask better questions, understand the research, recognize misinformation, and become informed partners in their own healthcare because education reduces fear. Knowledge builds confidence, and informed patients make better decisions together with their healthcare providers. Final reflection. If you're watching this because you've recently received a cancer diagnosis or because someone you love has, I want you to know this. Take one step at a time. Ask questions. Seek information from trusted medical sources. Build a healthcare team you trust. And remember that healing isn't only about treating a disease. It's about caring for the whole person, body, mind, and spirit. If this story has encouraged you, please subscribe to Kaikatan Wellness. In future videos, I'll share what I learned about integrative oncology, acupuncture during cancer treatment, evidence-based herbal medicine, stress management, and practical ways to support your overall well-being during difficult times. Thank you for spending this time with me and allowing me to share such a personal chapter of my life. I'm Dr. Guadalupe Vanderhorst Rodriguez. Until next time, may you find strength in knowledge, peace and hope, and wellness one step at a time.